All right, good afternoon, everybody. We're going to go ahead and get started. Welcome to our Missouri Open Door Benefit Series for June. Today's topic is going to be Medicare Preventative Benefits and Services. And we had a little bit of a scheduling conflict, so Medicaid wasn't able to join us to present today, but we will have another session on Medicaid Preventative Benefits and Services, so we can still get you guys that information. My name is Angelina Alpert. I am a research assistant at the University of Missouri, Kansas City Institute for Human Development. This series is sponsored by Medicare Improvements for Patients and Providers Act, or MIPA, Priorities 1, 2, and 3. So Priority 1 is Missouri SHIP, the State Health Insurance Assistance Program, who we have Judy and Sonia here today with us. And then we have the Missouri Department of Health and Senior Services on behalf of the AAAs, and then UMKC as the No Wrong Door designee for the state of Missouri. Next slide, please. And if you are unfamiliar with the Missouri No Wrong Door, the goal of No Wrong Door is to transform the way people access services in the community. So it supports individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. So the idea of these open door series is to enhance integrated supports. So we have the integrated support star as part of the Charting the Life course, which the goal of this is to focus on 5 main aspects of supports and services. So sometimes when an individual uses only eligibility specific services, it can keep them from being in the family and the community that they want to be a part of. So we want to integrate those services and supports into their life. So we have personal strengths and assets, relationships, eligibility specific services, which are needs-based government paid services. And those are the services and supports that this benefit series is focused on. Then we have community-based, which are things like places in the community that everybody has access to, schools, faith-based communities, parks, groups or membership organizations. And then we also have technology, which is personal technology, assistive technology, environmental technology, and we have a open door series on that as well. So this is the schedule of those open door series if you are new. The benefit series, which you're currently at, are on the second Wednesdays of every month from 12:30 to 1:30. The next one is going to be on July 10th. That's going to be Medicaid 101. And then for the technology series, they are on the fourth Wednesday of every month from that same slot, 12:30 to 1:30, and that's coming up May 22nd. I'm sorry. It's coming up June 26th, and that's going to be vehicle modifications. And if you are unable to make any of these live, they are recorded and posted to the Charting the Life course YouTube, and you're able to get access to any of them there. All right, and I'm going to pass it over to Judy, and she's going to take it away for today.
Okay. Good afternoon, everyone. My name is Judy Caseman, and my picture is not showing, so let me see. There we go. I am with Missouri SHIP, and I'm the Outreach and State Level Partnership Lead, and I'm very happy to be here with you all today. I don't often get to be involved in these series except from a planning standpoint, so to have the opportunity to present information and hear questions and that kind of thing is a very special day for me. So thank you so much for attending today. This presentation is intended for Missouri Medicare beneficiaries, their family, caregivers. It is not intended for the media or any licensed insurance professionals. So if any of those folks are out there in the audience, unfortunately, I would have to ask you to please depart, and you can contact the Missouri Department of Commerce and Insurance for any information that you might need. So Today, we are going to be talking about not only who Missouri SHIP is in the event that you're not aware, but we're also going to spend some time talking about Medicare benefits, some of the preventive services that are many times free for you. And so we'll start off talking a little bit about who is Missouri SHIP. We are a trusted resource since 1993, available to any Medicare beneficiary, their family, caregivers, professional staff throughout the state of Missouri. Our whole purpose in life is to bring Medicare knowledge, Medicare information through our trained counselors to communities throughout the state. And those counselors provide free, unbiased advocacy, education, and assistance to anyone who has Medicare, and many times those who are starting into Medicare. And our whole goal is just to help make it easier for informed decisions about what Medicare is and how to spend your healthcare dollar to the best. So we are a year-round SHIP. We are opened 12 months, 5 days a week from 9 to 4. And we are fortunately and blessed to be part of a national group of state health insurance assistance programs we have a network of 54 states and territories. This SHIPs were created by Congress back in 1993. And even back in 1993, the whole goal was to provide Medicare education and assistance. And it provides us an opportunity to be many times, as far as being an advocate for folks within the state, we're able to provide feedback on any state and local problems that seem to be consistently arising by being able to share that with the Centers for Medicare and Medicaid Services. The other thing I want to make sure I let you all know is that we do not sell or promote any insurance company or its products. So when you search us out for assistance, we are there to provide education and assistance to you, your family, caretakers, to help you understand Medicare and make good decisions. So I mentioned a network of counselors, and we're very blessed to have about 180 plus counselors that we have trained and certified based upon for their Medicare training. So our counselors, again, that are located statewide, represent the Missouri SHIP you might see them at outreach events like booths, health fairs, senior events, community events. They may do presentations also. They are there to promote the program, to offer Medicare 101 group education presentations. And they are also recruiters and mentors for new counselors. The great thing that they do with all of their knowledge and experience is that they offer one-on-one counseling by phone, face-to-face. We could do virtual within the community or at counseling sites. So anytime that you have a question about Medicare, we're only basically a phone call away. They also help assist with Medicare enrollment. If there's some financial programs that you might qualify for, they will do the screening and enrollment with that. And those programs many times help pay for some of your Medicare costs and some of your pharmacy costs. So our SHIPs are challenged, our counselors are challenged to do a lot and to know a lot. And they've been doing this. We've had counselors in place since 1993. So the counselors can help you, anyone in the community, with any enrollment and billing questions that you might have. Sometimes when you're getting ready to go into enroll in Medicare, you're not sure exactly what the first step is. By contacting us, we can help you plan out what those steps are. And if you have an employer, a plan that's going to carry you on, we can help you navigate through that. Many times we get calls from folks that say, I got something for Medicare that says my doctor did this procedure on me in the office, and that was never done. And so we can also help unravel any of those billing questions that you might have. They also explain Medigap supplement insurance plans. Those are certainly an option in addition to original Medicare. And they can also help with Medicare Advantage plans as far as explaining to you the pros and cons, what's covered, not covered, and those kinds of things. Also, they excel in prescription drug plan comparisons to make certain that during open enrollment time or when you're first coming on as a Medicare beneficiary, that you understand what your drugs are going to be, what's covered, what your copays might be on those. And so they're great at helping to explain that. They also will help screen for any public benefits, such as Medicare savings programs and low-income subsidy. Medicare savings is a Missouri-based. Low-income subsidy is based nationally or federally with the Social Security. Appeals and grievances, and suspected waste and fraud. And we're very fortunate to have one of our partners that is Missouri SMP, which is the Senior Medicare Patrol. So what we're going to discuss today is really kind of multifaceted, but trying to give you some basics on the prevention and wellness options that are available. So we're going to talk about, we've already finished talking about Missouri SHIP general information. Then we're going to talk about prevention and wellness benefits that you may not be aware that you have. We're going to talk about how do you access those prevention and wellness benefits? Is there a cost to it? How can you partner with us to help you understand that? When you might need to make a call to Missouri SHIP, and what makes Missouri SHIP a little bit different. So those are the topics that we'll cover. If you have questions along the way, if you would put those in the chat box, that would be awesome. Otherwise, we'll have time at the end of the presentation to answer any questions that you might have. So it would seem maybe pretty obvious to us when we talk about preventive care that it is the process for keeping us healthy. The whole concept is to obtain services in advance or be screened for things in advance so that if you do develop a certain condition, the chances of it being more severe because it was caught early might be a benefit to you. So the preventive care are really health services that basically prevent illness, detect a medical condition, or help you maintain your health. They are designed, many of them, to occur on a certain schedule. You know, sometimes when you start talking benefits, preventive benefits, you might hear someone say, well, you can have that every 2 years or every 5 years. So these are really preventive care designed kind of in a schedule, general's calendar or general schedule about how to receive treatment for illnesses and disease. And then what Medicare Part B is going to cover with preventive services in most situations. There are many prevention and wellness services that have no charge to them. And that usually comes as a little bit of surprise to folks to learn that, but we do have some. Original Medicare and Medicare Advantage plans provide preventative care if eligibility requirements are met. So if you currently are on a Medicare Advantage plan, you will want to reach out to them to talk to them or to see if they will send you information about any additional prevention and wellness benefits that you might have. For us and for the Medicare side, we will be showing you several resources throughout the presentation that you can access through CMS. or through our Facebook. So we'll be talking about those also. Okay, so when we talk about some general things or general guidelines, just to keep in mind, if you are on original Medicare, which means that you have Part A and Part B, you're paying nothing, no deductible or coinsurance for most of the preventive services if you see a participating Medicare provider. So if you're getting ready to start with a new doc, one of the first things, if you're ready for Medicare, is to ask are you a participating Medicare provider? If not, that's going to signal to you that they're glad to see you, but they're not going to be doing any direct billing on your part for original Medicare. The preventive services that you will see associated with Medicare are recommended by a preventive services task force that was developed many, many years ago. And they make recommendations based upon data about what approved conditions may be added. When I first started working with the Missouri SHIP program years ago, the number of prevention and wellness opportunities that people have are much different than what they are today. And that is because over the period of time, this task force has been able to identify areas where prevention has been a plus, and therefore they can recommend if it's 100% covered or a zero cost sharing. And so this task force has been in place for a long time. You may be charged if you see a non-participating or an opt-out provider. And that's why I made that comment. If you're getting ready to move into the Medicare arena, you really need to have the first thing to ask is if your doctor is participating provider. Also, if you are a Medicare Advantage participant, always check with your plan to fully understand what preventive services are covered and if there's any additional costs. So anyway, always check with your plan to understand what services that Medicare Advantage plan is really going to provide that's preventive and really what cost is associated with it. That's not something that I am able to do today, but if you're an Advantage plan, just use that number on the back of your card and inquire. So in general, if you are seeing an in-network provider, in most situations, you're not going to pay anything for the preventive services that are covered with zero cost sharing by original Medicare. Plans are required to cover your care without charging deductibles, copayments, or coinsurance, as long as you meet Medicare's eligibility requirements for the service. The reason I read all of that is you will find as we go through some of the prevention and wellness, it will say you must be enrolled in Part A or you must be enrolled in Part B. So if you're not meeting those eligibility requirements, then that plan may not cover or they may ask for additional monies. Plans can also charge for any preventative services that original Medicare does not cover. And we'll get a little bit further along in the presentation. You'll see me mention some things that are not considered a preventive services, but still are covered under Medicare. And if you see an out-of-network provider, you may be charged. And that would be the same for Medicare or even for a Medicare Advantage plan. So always know if your doctor's a participant. That's the big thing. There are some things to be aware of as you're thinking about prevention and wellness. There are certain circumstances where you might be charged a diagnostic service that might be related to preventive services, even if that service itself is covered at 100% cost. And this is where you get some of the examples here that's listed. They may bill you for diagnostic care during a preventive visit, and we'll talk about a preventive visit, if you had a polyp removal during a colonoscopy. So you might be charged a facility fee. You might be charged for the service, the doctor fee, and that kind of thing. So and I'll give you an example here, what I do with my doctor when I go to my annual review is she will always say, is there anything new going on with you? And if I say no, then we go ahead and proceed with that wellness visit. If I say yes, then she does not proceed with that wellness visit. She deals with what my immediate problem is. And then my visit has to be scheduled for my wellness visit at another time. So those are questions to ask for your doctor too. You also need to keep in mind that each preventive service has its own eligibility requirements. So you may find for mammograms, you may be within a certain age group, you may be able to have one a year. Whereas if you're doing glaucoma testing or something like that, it might be more frequent. Or if you have a colonoscopy with nothing found, you may be scheduled farther out for a follow-up than somebody who had polyps. So even though they're covered as far as a preventative service, you may find that there's different requirements for it and guidelines. Medicare may only cover a service at certain times of the year, so you'll see that also. They may say mammogram once a year, no sooner, except if you're high risk, for example. Or they may say colonoscopies only every 4 or 5 years, unless. So many times you'll find when you begin to research the prevention and wellness, you'll find some of those unless clauses. And that is if you have a family history or you're at high risk for something. And again, Medicare may cover some of those preventative services more frequently. If a doctor feels that there's a condition brewing there that you need some help with. So this is a guide I would highly suggest that you all contact through Medicare.gov to get. It is a guide to Medicare preventative services. They are listed in this book and how often you can get them and if there's a cost or whether it's a free service. So you can just sign on to Medicare.gov, enter in your guide to Medicare preventive services, provide your address, and they will send that out to you. You may also have a area agency on aging, for example, in your community, and they may have something like this in stock, and you might check with them and see if it is available. I'm not certain. The area agency on agings are partners of ours. Some keep quite a bit of stock, some do not, but it's always worth a call to see if you can just walk into their office, pick up one of the booklets. And if you're not familiar with them, I'm sure they would be glad to share with you some of the services that they provide in addition to the counseling, Medicare counseling that they do with and for us. So mark this one as a good one to get. So now we're going to begin to talk a little bit about some different types of visits. And these are ones that if you have an opportunity, you need to take advantage of them. And you will see that, I think, as we work through some additional slides. The first one I want you to be familiar with is called Welcome to Medicare. This is a one-time preventative visit within the first 12 months of signing up for Medicare Part B. Okay, so once you sign up for Medicare Part B, you have a one-time preventative visit within that first 12 months that you can see your doctor. That visit is covered by Medicare. And again, if you see a physician who participates in Medicare. So you might be asking, what is this going to entail? And it's a little bit different. It's not like just going into your doctor's office and saying, I have a sore throat. This is a little bit more, because what they're going to begin to do is to kind of set a baseline for your health as of the time that you come in to visit for your Welcome to Medicare visit. So the doctor or one of his nurses is going to record and evaluate your medical and family history, any health conditions that you have, medications that you're taking. They're going to do blood pressure, vision, the dreaded weight and height to get your baseline. And they're going to make sure that you're up to date with your screenings and your services. And so they have with them a guide that tells them what preventive screenings and services you should be thinking about. And they will talk with you about that and probably make some suggestions based upon your history about when maybe you should have a certain screening done or a testing done, that kind of thing. They will order any tests depending on your general health and medical history. And the thing that is really great at the end of this visit is that you should have a plan or a checklist of what free screenings and preventative services you might need. So that is your first step right there of your welcome visit. And that then will become the baseline and the guide going forward. So when we talk about your annual, can we go back one, Sonia? Yeah. What do I bring to a welcome visit? You always want to go prepared so that you can make the most out of that free visit. So if it's a doctor that you've not seen before, you might want to bring your medical records from another physician, and that should include your immunization record. You need to bring your family health history. That's very important. A list of all your prescriptions, whether it's over-the-counter, vitamins, any supplements, anything that you are taking. You need to either write down, or I don't think folks would be upset if you put them in a baggie and took them in so that they can record the exact information. So if you are writing your prescriptions down, includes dosage, how often are you taking each of your meds, and what condition you're taking that for. So that is, when you walk into the doctor's office, he needs to have all of that. They will do your baseline medical review. And when you leave, you should be having some type of a document presented to you for prevention and wellness going forward. So then we have something, not your Welcome to Medicare. This is a different type of covered plan or covered visit, and it's called the Annual Wellness Preventative Care Visit. There is a requirement here, and you must be on Medicare Part B for at least 12 months in order to qualify for that preventative annual wellness visit. That annual wellness visit will occur every 12 months. And what they do, you and your doctor will continue to develop or update any personalized prevention plan that you documented when you did your Welcome to Medicare visit. That annual wellness visit is really an ongoing visit to make sure that you are taking advantage of the screenings, taking advantage of any treatment options. They're going to, if there's any disability that's based on your current health and risk factors, that will all need to be discussed in this annual wellness. So remember, it's very different from the Welcome to Medicare visit, and it's going to occur every 12 months at a minimum, but you have to be on Part B as in boy in order to qualify for that. So what should you expect with an annual wellness visit? Well, they're going to do a complete health risk assessment, which you may hear folks refer to as an HRA. Health risk, that's that packet of information you get where you have to write down all of your past history, your family history, any prescriptions you have, all of your insurance carriers, those kinds of things. So all of that you would have to fill out. They again will take a look at your height, the dreaded weight, blood pressure, and any other measurements that they feel is necessary for your particular situation. They're going to look for any cognitive changes. They have an opportunity to discuss with you any health advice that they feel you should take advantage of. They're going to talk about a list of risk factors and treatment options available to you. And again, end result is you have a personalized prevention plan to review and update each year when you go back for the visit. So you're kind of seeing the progression here. Next, there you go. So again, as if when we were doing the Welcome to Medicare, there's things that you need to bring with you. Many times doctors' offices will send out that HRA, that health record assessment, to your home. And so you can take the time to fill that out before you go to the office. Sometimes they will say, come 30 minutes ahead of time. Just a hint, 30 minutes is sometimes not enough time to complete that HRA. So if they can send that to you at your home, it's an advantage to you to make the most of your time. You need to have a list of your immunizations with you. Again, your family medical history. Any medications, again, it's the vitamins, minerals, over-the-counter, prescriptions, all of that. And any questions that you have or concerns that you have. For example, you may find that your balance is not as good. So that's something that you would want to bring to this visit to say, you know, I'm noticing that my balance is a little bit off from last year when I saw you, or I seem to be having more trouble with my shoulder than I did last year. So any of those kinds of questions or concerns that you're having about your health, that's an opportunity for you to bring that with you, and so that you can get some answers. So again, this HRA, again, is a lengthy document, but it's going to be asking you about any chronic diseases. Have you had injuries? Are you at risk for injuries? Any risk factors that you see? Do you have any urgent health needs? Can you still take care of yourself at home? Are you starting to have some difficulty? What is your level of physical activity? Are you a sit in the chair, watch TV, or are you gotta walk my puppy 5 times a day, and we go about 4 miles a day in our walk? If you've had any history of falls, and when they say history of falls, they mean history, not just did you fall in the last month. Any pain that you might be having, any eating patterns that you notice are changing. Do you eat less? Are you not hungry at all? Are you extremely fatigued to the point where you just want to sit in your chair? Have you noticed that you are drinking more or your tobacco has increased? And have you had to get additional medications in the last year to help with some of these things? So this is that assessment. Again, this will be the talking document that the doctor has with you to guide your visit. Again, remember that an annual wellness visit is not the same as an annual physical. So you've got the Welcome to Medicare, you've got your annual visit, and now you can have an annual physical. So an annual physicals are not covered as part of Medicare's preventive services for no cost. The physical might be preventative, but it's not included. So if you're one of those folks that says, I need to go have my annual physical, that may or may not be covered. So here is an example of comparison because there's a lot of types of exams. We've got the Welcome to Medicare, we've got your annual, we've got the wellness. So what's the difference? So with the physical examination, the doc is usually going to be checking your entire body for any signs of existing health issues. The wellness exam, you're going to have to fill out that HRA, and that's going to be the talking document. On the physical exam, they're going to check your eyes, ears, nose, throat, see if they find anything. They're going to listen to your heart and your lungs to see if there's any irregular sounds or crispiness. They're going to test your motor function and your reflexes. You may have a pelvic and rectal exam, and they're going to measure your height and that darn weight again, and your blood pressure. So all of those things are included in a physical exam. For a wellness exam, you've got the HRA that you will need to complete before you get to the office if possible. He's going to confirm your medical and family history. They're going to take a look at your current prescriptions and providers. They're going to look at your height, the weight, and blood pressure. They will also look at signs of memory loss, dementia. Are you more frail? They're going to document your health risk factors and what treatment options there might be. And they'll develop a screening schedule. It's like a checklist that they have that you can use throughout the year to bring you back to what was recommended for your preventative services. So hopefully that kind of gives you a little bit of a feel for the physical exam versus the wellness exam, which Medicare covers. Okay, so we talk about vaccines. This is where your Part D plan can come into play as well as Part D plan. So these vaccines, usually any common vaccines that are out there, either Part D or Part B will cover those. Shingles is an example. That's kind of a high-priced one if you don't have that Part D plan yet. So shingles is a high-priced one, so you want to have that Medicare Part D plan identified so it's available. Flu, pneumonia, hepatitis B, some of the COVID vaccinations are covered by Medicare Part B, as in boy. And beginning in January 2023, all Medicare covered vaccines should be free to you, meaning you should not owe any cost sharing, a copayment, coinsurance, or any deductible. So if they say on your checklist that you need to have your flu shot, your shingles shot, any of the other vaccines, you can have those anytime during that covered year, but maybe make sure that you ask your doctor, should I have wait times between those shots, or can I just go in, have them all done at one time? And your physician should be able to help prioritize based upon your physical condition, which he would recommend first, second, and third. So now I've mentioned a preventative checklist. Here's an example. And again, you can get this from Medicare.gov. It's a little difficult to see that print there, but that would be the source. Go to Medicare.gov publications and look for publication 11420, which is a preventative services checklist. And I would recommend that you do that. It's good to have that to take with you to all of your doctor's appointments. And it gives you an opportunity to ask any questions that you have about this and to keep track of what you've taken advantage of. So this could be one of those documents that is updated during your visits with your doc and let you know when you had it, if you're not going to have it or whatever. on that. And you'll notice there's a couple of pages here, all the way from the Welcome to Medicare to mammograms, glaucoma screening, hepatitis B and C. There's some great Medicare diabetes prevention programs that are available, prostate cancer screenings, all of that. And so what we also like to do at MoSHIP is to provide ongoing prevention and wellness, and we do that through our Facebook. And so Sonia's going to bring up here a list of some of the Facebook posts that we use, and we're going to show you the topics. We many times try to correspond this with the National Health Awareness Month, but it's a good opportunity to remind you that maybe it's time to take advantage of this prevention and wellness. So here's an example. It says January is Cervical Health Awareness Month. And then it starts asking you several questions, tells you that Medicare Part B would cover the screenings every 2 years for all women on Medicare, and every 2 years if you were high risk or if you're childbearing age and had an abnormal PAP, for example. So it gives you those accept kinds of things. And then they'll tell you, is it a free benefit? So here we have one on glaucoma, and many times this appears in January because it's a glaucoma month. Gives you a little bit of information, and again, it identifies here that if you're someone with diabetes, a history of glaucoma, if you're African American over age 50, or if you're Hispanic background, 65 or older, you're considered high risk, and so you need to be talking with your doctor about this. And if you have original Medicare, you only pay 20% of that amount. And then the Part B deductible applies. And they'll give a notice here. They're saying if you have Medigap or Medicare Advantage plan, contact them for more information on whether this would be totally covered. You'll notice on here that there is also the phone number at the bottom where you can contact our contact center, which is MissouriShip.org. Phone number 800-390-3330. And if you have questions or would like some assistance with understanding what some of these prevention and wellness are, we will hook you up with one of our counselors, and they can have that discussion with you or make a referral for you as to where to find some information. So here's another example of one. It has to do with heart disease. Tells you what Part B covers. Talks about some behavioral therapy, and that the benefits are free if your doctor takes assignment. So again, you'll find these on our Facebook. There will be something every month, sometimes 2 a month. Again, just to try to remind you of what prevention is out there. Here's your new to Medicare. Don't forget to schedule that if you're turning 65. And there's the instructions and the information about it. You can also look at the next one, which is has to do with sexually transmitted infections. So those are all there to help you with that if you need some assistance. And then we have the Hepatitis Awareness Month, which happens in May. Again, it's talking to you about that, gives you some statistics, what Medicare will cover. And the next one has to do with Women's Health Month. And reminders here of things that you need to be doing on an annual basis, unless the doctor says otherwise. Here's one that's about Alzheimer's and brain awareness. This is for June. So you'll see this one, if you haven't already, in our Facebook post. And it's just reminding you of what's available to you, and that your doctor can help you work through some of these cognitive functions and check for any conditions that you might have and help you manage that a little bit better. Here's another diabetes one talking about this, risk factors, what's free. So this will occur, I think this is in June. Then we've got Men's Health Month coming up. So husband, brothers, friends, remind them of things that they need to be doing also. So we're just going to kind of go through these a little bit here. This is another one that has to do with depression and anxiety. Then we've got one here for Immunization Awareness Month. And welcome to Medicare and what that includes and how to get started with that. And your yearly wellness visit, we've talked about that. So they're reminding you here, don't forget about that. And then alcohol and dependency and tobacco use increases are things that can cause concern. Prostate cancer, you'll see that out there. And again, I think you're kind of getting the feel about how it is. They'll give you, examples, a little bit of information on it, and they'll talk about what's covered. Does it cost? Is it free? Those kinds of things. So by checking our Facebook, you will see these scroll through every month. Sometimes you may see a couple of them. And that's just our way of trying to promote prevention and wellness throughout the state. So here's a little bit more information that you will find in the screening checklist that I showed you earlier. And it will take the service, for example, diabetes screening, and it tells you the frequency with which you should be checking on that. And how many hours, for example, might be covered, how many months between your visits, unless you're at risk for something. So this just continues on with these types of informational based upon services. Sometimes people don't realize that there's nutrition therapy that's available, obesity screening and counseling. Those sometimes are things that people are not aware of that are available to them. I recently took advantage of the nutritional counseling because I had several conditions going on at the same time and I couldn't figure out what to eat that wasn't going to aggravate something. So I had a visit of an hour and a half and it was a wonderful experience, and I would encourage you to take advantage of some of these things. There's smoking and tobacco use cessation. That's a counseling, and it's up to 8 face-to-face visits in a 12-month period for anyone on Medicare. So those are all the types of things that you will find in that one booklet, or the second booklet that we suggested for you. In addition, there's some additional resources available. You can call us for an appointment with a SHIP counselor. And that's 1-800-390-3330. We have wonderful counselors throughout the state through organizations that we partner with that do an awesome job of helping and counseling. You can go to the Medicare.gov website and ask for that Prevention and Wellness Service Guide. There's the Missouri SHIP Facebook page where every month, if you follow us on that, you're going to be finding prevention and wellness information. And then the other thing to keep in mind is that all of our partners, and we participate with all of our partners, have outreach events that go on throughout the state. And so that's an opportunity for you to talk with someone at a booth and pick up material that might help you with anything about Medicare, but about prevention and wellness also. So between the Medicare.gov resources, you also have these additional resources available to you, and we hope you will take advantage of those. So just in closing, just a kind of a reminder here that our services are free to clients. We are not an insurance provider and we don't sell anything. We are a federal program. We're run by a grant that we've had since 1993. It is administered by the Missouri Department of Commerce and Insurance. They receive the grant. We do the work along with our partners. We provide unbiased counseling. It doesn't matter to us, what your questions are, what your background is. any of that. We help individuals make informed decisions. So if you need help, regardless, you can contact us and know that you will have really good service from our counselors. Again, we've been doing it since 1993, and we are considered a nonprofit organization. So we also have an opportunity that I like to talk about if you are interested in becoming a volunteer. If you are someone who's recently retired or been retired for a while, and you feel like you would like to do something to give back to your community, please consider going out to MissouriShip.org and learn about our volunteer or partner program with Missouri Ship. You can also call the 1-800 number again. Let us know what county that you're in, and we will link you up with one of our regional liaisons to answer any questions that you might have about what it means to commit to counseling with Missouri Ship. Some important dates to always keep in mind. January 1st through March 31st is Medicare General Enrollment. And that's lets you get a chance to take a look at that Medicare Advantage plan. And if you decide you want to make a change, you can return to your original Medicare and add a Part D plan during that time period. And then what we're coming up upon here is October 15th through December 7th is the Medicare annual enrollment period. And this is a time where we encourage all Medicare beneficiaries throughout the state to take a look at your drug plan that you're on or your Part D plan. Make sure that your meds are still going to be covered for the next year. Take a look. Is it possible to have your meds covered and maybe to have a less premium or copay? So it's a chance to enroll in a different Part D plan that would start January 1st. And again, you can, even during this time, change or enroll in a Medicare Advantage plan that would start January 1st. I would highly encourage you to remember this time period and call us for that comparison. Again, we're not going to tell you what you should do, but we would like for you to understand what your plan versus some other plans with your medications, the price differences, so that you can make a really good health decision, but also decide how best to use your healthcare dollars. This is also a time when we talk with folks about low-income subsidy or limited income subsidy plans, Medicare savings plans, because they can many times save you some money. And I don't know about you, but sometimes it's all about saving a few dollars here and there, and sometimes it can be hundreds of dollars. So, and just a reminder that if you happen to be on a Medigap plan, there's no open enrollment for Medigaps. You have an open enrollment for Medicare and for the Medicare Advantage plans. We highly encourage you as we go into the fall to sign on to the Medicare.gov and create your account, your Medicare account. That way, when you begin to talk about or just trying to decide about your drug plans for the coming year, you can either go onto the plan finder, or you can contact us at 1-800-390-3330 in early October, and we will schedule a free appointment with one of our counselors. And again, our counselors are trained and certified on an annual basis. And again, we have great counselors throughout the state. So that's about all that I have for you today. If you have some questions, I'm more than happy to try to answer those. And if I don't have an answer, we will certainly get information back to Angelina so that she can send it out to all of the attendees. And again, here's just a little synopsis here of when you should call Missouri Ship. If you're turning 65, if you're on SSDI disability for 24 months, if your Medicaid or Marketplace is ending, During open enrollment, which is coming up before we know it, employment coverage is ending. You want to ask for a presentation for a Medicare 101, something called Stretching Your Medicare Dollars that helps generate some understanding about what plans are available for you or what options you have, or a more detailed prevention and wellness plan. And if you need some material, any resources that we have, like our Plan Finder cards, saving Pay Less for Medicare brochure that helps with some guidelines and some information. All of those are available by calling that 1-800-390-3330 number. And we're happy to send that out, any resources that we have out. So, do we have some questions?
I don't currently see anybody with their hands up or anything in the chat. Anybody here, feel free to put them in the chat. Feel free to raise your hand. I can go through those as we're on here for the last few minutes. Thank you, Judy and Sonia, for presenting for us today. It is much appreciated.
Sure.
If there aren't any questions, the recording of this will be posted on YouTube, and you will also get the slide deck as well within a week if you are on our listserv. And then,
yeah, definitely an interest in hearing from Mo Health Net. That'll be good.
yes.
Yes. Well, I thank you for allowing me to come, and Sonia Bashkaran, who's one of our regional liaisons and a MIPA 1 coordinator. We thank you very much for welcoming us into your program today. Anytime we can be of assistance to you individually or with your family, please just call that 1-800 number. That is what we're all about. That's all we do is Medicare. So we're happy to help. So thank you very much.
Thank you all for being here today. See you next month.
You bet.